Which is true. See? I said you and I are competing for class clown.
All right.
Yes, I will be abstaining.
All right. Good afternoon and welcome. I call this meeting of the Community Development Human Services Committee to order. Always love banging the gavel. I'm Councilmember Jason Dozier. I am joined by fellow committee members Liliana Bakhtiari, Councilmember Jason Winston, Councilmember Byron Amos, and we can go ahead and move forward with the agenda. I'll motion to adopt the agenda. Can I get a second? Second by Bakhtiari. Please open the vote. All right. All right. Councilmember Bakhtiari, seconded. Councilmember Winston?
Aye.
Councilmember Amos?
Aye.
That is 4 yeas, 0 nays. Next item is the approval of minutes. I will motion to approve, second by Bakhtiari. I believe we're still doing a voice vote. All right. Please vote.
And the vote is closed.
All right, the minutes have been approved, 4 yeas, 0 nays. The next item is public comment. I know we have a few people who signed up for public comment. All right, we have 3 public speakers. Just a reminder, 3 minutes per speaker. I will gently whisper into the microphone when we have 30 seconds so as to not disrupt your comment, but I do want to let you know when you're coming close to an end. First speaker is Ms. Henry Jordan.
What exactly is a chintoism?
Good to see you, Ms. Jordan.
In the Spirit of Christ, everyone that's here. Husband, love your wives, even as Christ also loved the church and gave himself for it. Ephesians 5th chapter 25th verse. The Greek word rendered love is agapio, which denotes the willing sacrificial giving on the husband part of his wife. Without thought of return, James Griff sought to kill me, so he asked to be killed and rejected me as becoming his wife. The wife had not power own body but the husband. And likewise, also the husband had not power his own body but the wife. 1 Corinthians 7, chapter 4, verse. For he let over hundreds of women have authority over his body. James told Christ he didn't desire for me as his wife. God told me James has been with so many women, those spirits will jump on me spiritually. I cannot have or handle him as a husband. Give her the fruit of her hands, and let her own works praise in the gates. Proverbs 31:31. She's a woman of God who is enterprising and dedicated to her home. A husband of God have given him, should give his wife her income, and let her receive the praises for what Christ has done in her. I dream of starting a church, and James was attempting to teach the men to be a Christ-like husband. But the men rejected him because they knew he didn't set the example of a Christ-like husband. Likewise, ye husbands, dwell with them according to knowledge, giving honor to the wife and to the weaker vessel, as being heirs together of the grace of life, that your prayers be not hindered. 1 Peter 3, chapter 7, verse. The gift was given to promote Jesus' righteous word to come alive in us. not to be seen as a superwoman, rather as a weaker vessel. Christ said because James rejected his word, I must reject him. Your deliverance plan can't deliver like Jesus' plan. Receive us, we have wronged no man. We have corrupted no man. We have defrauded no man. 2 Corinthians 7:2. I ask Jesus, can you create income without deceit, defraud, treachery, mischief, lying, robbery, extortion, etc.? Then God started giving me business plans, intellectual properties before I knew it, to back up his holy word. James has worked against Christ's righteous word that promotes. You need to seek to obey Jesus. Jesus is life. Jesus said, I can't work your job because he paid me to work for him. And you said he didn't. And you lied, not the word of God. And you know it.
Thank you, Ms. Jordan. Our next speaker is Brother Antony Muhammad.
Lord, Metro Hotel, S.A. I command our indigenous committed antiquity ancestor to teach my soul spiritual energy every day. I am that I am, Negas, King of Kings. I'm not a believer in the Roman Catholic Church, religion, Christianity. In your scriptures of the Bible, the 66 books from Genesis to Revelation, there is not one person, not one human person born from the womb of a woman canal. I call on this city to remind you, city of Atlanta, let's make sure Atlanta is a place everyone can call their home. As I was walking down here early this morning, a young woman, maybe in her early 20s, with a baby in her hand, a committed woman. For y'all that don't know our ancient words, that's a dog person. Living on the street, and you see so others around her. But I made it known that I could throw something to you, young lady, so I gave her something. But why is I'm asking that, or talking about that? For us that look like me in this city, we the one put you all in this office. In the 70s, Mr. Maynard Jackson, he fought to make sure we can get some representation from the state of Georgia. Stacey Abrams said, Georgia is one of the roughest states in the Union. I'm 70 years old. I know Jim Crow. I know segregation. But I was like anyone of you all. Wanted more. Went to the military, went to Georgia State. Got in my banners. And I still recognize the need of our people having justice, fairness, and equality. We had a presentation down here this morning. Diversity of all the races on the earth come and get their citizenship. And you got people look like me on the street, can't even get you to give them a blanket. Can't even get you to give them an opportunity to get some training. But you'll bring somebody tens of thousands of miles away. Ukraine. You're giving $1 billion to help the Caucasian. I don't have no problem with Caucasians showing self-preservation, but have some love. How long you got to let the 90% of the people that look like me, Miss Queen Elizabeth, be under your influence? And then you got King. So I ask you,
Seconds.
Miss Keisha Lance Bottom was in Washington, and she was up there speaking about her sorority, Delta Sigma Theta sorority. Their purpose is to support and establish programs in local communities. What about you come to Atlanta and ask Mr. President Biden, give us some money so I can go take care of some needs of dog peoples in Atlanta? Having one city in the union that can allow us to have some justice, Mr. Dozier. One city so the people don't be on the street. And I thank you. I greet you as I come. Assalamu alaikum. Metro Hotel. Ashe, Ashe, and Ashe.
Thank you, Brother Muhammad. Our last speaker is Brother Ron Shakir. There you go.
Ron Shakir, Southwest Atlanta. I was here this morning. I didn't intend to come back, but something drove me back. And what drove me back, when I was going past right before I got on I-20 going west, I saw people sitting on a curb. It reminded me of the report on WSB yesterday, where they showed where the city of Atlanta was shutting down camps. On the fence across the street from the safe gateway was a young woman under 30 years old with a baby on her breast and a 3-year-old boy standing next to her, wondering like 3 years old, what are we doing? I want. I called a friend, and I decided to just go back and go on home. But before I did that, I came back around looking for her, because that's what I decided to do, go home at first. But I came back around looking for her, and she was gone. And I'm pretty sure some hearts reached out to her, because she wasn't alone. It was other people sitting on that curb. She didn't look like a dope addict. She didn't look like she was sick, but even if she did, I'm reminded of the fact that we are talking about community development and developing something called a stitch, or calling for more money for the Beltline, train systems to go and take people to the freaking Beltline. It's a shame that we would favor in this city, and I believe it has something to do with the displacement of African Americans. You want to continue displacing them, so you put these projects, these fake projects on top of them. The truth of the matter is that now we're taking the erasing of NPUs that Maynard Jackson, that they would go through planning. While I was looking at the news, I saw there was going to be a meeting today at 6 p.m. And that meeting is going to be about communities and planning for neighborhoods and transportation and what have you. But it won't be open to the public. It'll be on virtue, 6 p.m. Y'all are sitting here in the face of just 3 years ago, people were able to stand and speak on each issue that came through that y'all voted on, and if they wanted clarity, you would speak to it. If somebody would walk in with a paper that wasn't on the agenda, we can ask questions on it. We were able to speak in the beginning of the meeting, at the end of the meeting. Sometimes we get here late and we can't speak on the beginning, we wait to the end. Freedom of speech is very important to America. It's something that America stands on. Our community needs it. Martin Luther King used it. We won't be pushed back. We won't be going back. Martin Luther King said in a speech yesterday that we won't go back, and we need to listen and do what's best and right for our community, include everybody in our communities.
Thank you, Mr. Shakir. All right. Our next agenda item, colleagues, if you will indulge me, it's supposed to be presentations, but I do know we have a number of people who are going before our committee for communications, for appointments, and I would like to move forward with that portion first. Seeing there are no issues, let's go into the first communication.
Item number 1 is 22C5143, a communication from council members Liliana Bakhtiari, District 5, Alex Wan, District 6, and Matt Westmoreland, Post 2 at large, appointing Mr. Eric Tusink to serve as a member of the Atlanta Urban Design Commission in the real estate professional category. This appointment is for a term of 3 years.
Mr. Tusink, if you could join us at the podium, and I know you, I know a few of us know you, but if you could tell the community about yourself, why you're interested in this appointment, and we'll go from there.
Thank you, Mr. Chairman, council members. My name is Eric Tusink. I'm a 17-plus year resident of Grant Park, where I guess, ironically enough, given this appointment, I live in a new construction home. I'm a real estate and the managing partner of a real estate and business law firm based in Decatur. In addition to that, I also have renovated and or developed 2 historic structures there in Decatur, both the High House, which is circa 1829, what we believe to be the oldest two-story wood construction building still existing in DeKalb County. We also redeveloped the secondary chapel of Decatur First United Methodist Church, a chapel that was built in 1899, and the school building adjacent to it, which was built in 1949. I bring these things up as a way of letting the committee know that I have a deep commitment to the preservation of historic structures within not only Decatur, where I work, but also here in the city of Atlanta, where I reside. And I very much appreciate the opportunity to serve the city in historic preservation and/or determining the best way to develop historic areas and properties within the city of Atlanta. As y'all well know, our city's history when it comes to our historic structures can be a bit checkered, but I hope to be able to lend my expertise to the commission and hopefully do some good work there. And once again, I appreciate the nomination, and if you have any questions, I'd be glad to answer them now.
Thank you, Mr. Tusing. Councilmember Bakhtiari.
Move to approve.
I'll second. Any discussion? Seeing none, please open the vote.
The vote is open.
The vote carries 3 yeas, 0 nays, and 1 abstention. I believe the abstention was Councilmember Winston. If you could, for the public, explain your abstention.
Well, first, there's probably a good argument that the wrong Tusink is standing here for this nomination, since his wife may be the smartest person in the household. But I was served as co-chair with her on the Grant Park Conservancy's Summer Shade Festival. But Eric has also been a longtime friend, neighbor, who served as my campaign's legal advisor. So I will be abstaining from this vote, but I'm happy about his nomination.
Councilman Winston, I appreciate you putting that on the record that my wife is smarter than me. Thank you.
Thank you so much, Councilman Winston, and congratulations, Mr. Tusing. I know there's a couple other steps as far as the full process, but thank you for your continued service to the City of Atlanta.
Okay. If there's nothing further, may I be dismissed?
Yes, absolutely.
Thank you.
All right. All right, next item. Yes, are we missing an individual? Okay, that works. We'll come back to that one in the agenda.
Item number 3 is 22C5145, a communication from Councilmember Liliana Bakhtiari, District 5, appointing Ms. Lenny Williams to serve as a member of the Commission on Aging. The appointment is for a term of 4 years.
Ms. Williams, if you could join us at the podium. And just like I shared before, if you could tell us a little bit about yourself and why you're interested in this appointment, and we'll go from there.
One of the biggest challenges will be trying to be brief. I have been a resident in Atlanta. Okay. Oh, I wasn't that tall. Goodness. I've been a resident in Atlanta for a total of 17 months. Not because it was my choice, but because it took a very long period of time for my name to come up in affordable senior housing. And when I got the opportunity, I was delighted because I have a son that lives in Atlanta, and I wanted to make sure he's aging properly. So I have been a former senior center administrator in Missouri. I took care of both my mother and my stepfather for the final 21 and a half years of their lives. And golly, I've loved old people so long, I've become one. I have learned along the way that we have definite challenges, we have definite needs, we have dreams, desires, and goals. And if I can help put some implementation into programs that will prosper and benefit what has become a very marginalized segment of society, I will be thrilled. Thank you.
Thank you so much, Ms. Williams. Councilmember Bakhtiari.
I couldn't have been more honored to have nominated you for this position. I can think of no better person to serve on this commission. So
Thank you.
it is, I'm so glad that you're up for the task, and I move to Approve.
That's a motion to approve. I'll second that. Please open the vote.
The vote is open.
The
And the vote is closed.
The motion is accepted. 4 yeas, 0 nays. Thank you so much, Ms. Williams. Congratulations, and thank you for your continued service to the City of Atlanta. All right, next item.
Item number 4 is 22C5146, a communication from council members Liliana Bakhtiari, District 5, Alex Wan, District 6, Howard Shook, District 7, Mary Norwood, District 8, and Matt Westmoreland, Post 2 at large, appointing Mr. Dylan Nurse to serve as a member of the Atlanta Commission on Veterans Affairs. This appointment is for a term of 2 years.
All right, Mr. Nurse, good to see you.
See you, sir.
Just as before, tell us a little bit about yourself and why you're interested in this appointment.
All right, my name is Dylan Nurse, and it's an honor to be here with Chairman Dozier, as along with the rest of you on council. I am a veteran. I served with the United States Army Reserve for 8 years as a lieutenant, and I have spent my entire professional adult life working in service. I currently am the district director for Congressman David Scott. Can you hear me now? All right. I am currently the district director for Congressman David Scott. One of my major responsibilities is working with my veterans in the district, helping them access their benefits and making sure that they receive the type of assistance that they're entitled to. Most of the time, veterans access services and government assistance through the federal government, but that doesn't mean that the city or municipalities at large don't have a responsibility or an opportunity to serve veterans. I think that the city of Atlanta, which is home to a significant veteran population and a varied veteran population, needs to do more to provide not just resources, but also opportunities to serve again. I think that as Councilman Dozier shows, there are many veterans who maintain a servant's heart and want to continue to provide service for the community. And I hope to continue the tradition and the course that Mr. Dozier set for the rest of us and continue that service myself. So thank you for your time and your consideration.
Thank you so much. Councilmember Bakhtiari.
Yeah, I was honored to nominate Mr. Nurse for this position. I've been lucky enough to know him since we were in elementary school and reconnected with him after we moved to Atlanta in public service. And Dylan has helped me do everything from help people find housing to help families out of Afghanistan at the 11th hour that were under threat of attack. So, and I've watched him time and time again selflessly serve veterans and other minority communities in the city of Atlanta, and I have no doubt that he'll be an incredible asset to this committee. So I'm honored to know you, and I'm also honored to say that I move to approve.
Second.
Motion by Bakhtiari, second by Winston. Please open the vote.
The vote is open. The vote is closed.
Motion accepted or favorable, 3 yeas, 0 nays, 1 abstention. That abstention is actually me.
Yes, why did you abstain, Chairman Dozier? For the record.
So for the record, even though I think that Mr. Nurse will be a phenomenal asset to the city and on this commission, he also served as my campaign chair during the campaign. And so I just want to recognize that and want to thank him for his continued service for the city. And I look forward to working together. Mr. Nurse is also a constituent of mine, so I know we'll be working together no matter what. But just thank you for coming out today, and we'll work together.
I'd like to say for the record that I know Mr. Nurse likes me more, so.
I would like to abstain. Thank you.
Thank you so much. All right, next item.
Go to item number 6, 22C5148, a communication from Pierre Gaither, Executive Director of the Atlanta Board of Education, submitting the appointment of Ms. Stephanie Flowers to serve as a member of the Atlanta Beltline Affordable Housing Board. This appointment is for a term of 2 years.
Flowers, once again, good to see you again. And as stated before, please tell us a little bit about yourself and why you're interested in this appointment.
You can adjust, you feel free to adjust that any way you need to.
Good afternoon. My name is Stephanie Flowers, and I am a resident of the city of Atlanta. I live in the community of Pittsburgh, and I also serve as the chair of Neighborhood Planning Unit V. And my appointment to this board to me is important because I have spent over 15 years of my life advocating for education and community development, because both of those things are important for our kids to be successful in their lives and in their education. And so being appointed to the Affordable Housing Advisory Board for the Beltline is important to me to help to continue the conversation around housing, both affordable and workforce housing for the families in which we are serving in our communities and in the city of Atlanta.
Thank you, Ms. Flowers. Before I move...
Oh, I got to say, I do have a son in Atlanta Public School. He's a junior, and he goes to Carver Early College. I got to say that.
Thank you, Ms. Flowers. Before I move to approve, I just want to say that I've been a co-advocate, co-conspirator, co-organizer with Ms. Flowers for many years. She is my NPU chair and NPUV, and I'm so thankful to be able to make this motion because I know you've done phenomenal work, and I know you'll continue to do phenomenal work, not only for our communities in South Atlanta, but also for our city. So I move approval. Second by Councilmember Bakhtiari. Please open the vote.
The vote is open. And the vote is closed.
Motion carries 4 yeas, 0 nays. Thank you so much for your continued service to the city of Atlanta.
Mr. Dozier, only 7 people appointed to affordable housing for the last project dedicated to the affordable housing on the Beltline. Could you answer about the housing, affordable housing for the Beltline?
Mr. Shakir, I appreciate your comments. We're past the public comment portion of this. I'm happy to have a conversation with you beyond this meeting about that, but
7 affordable houses on the Beltline.
Understood.
Okay, thank you.
All right, next item.
Item number 7 is 22C 5149, a communication from Mayor Andre Dickens appointing Dr. Lakeisha Hallman to serve as a member of the Atlanta Development Authority Board of Directors, DBA Invest Atlanta. This appointment is for a term of 4 years.
Good to see you, Ms. Hallman. Thank you for joining us today.
Yes, I'm super excited to be here, and thank you all for having me. When I understood this level of appointment, I got even more excited. I founded my company, The Village Market, 7 years ago. I've been a resident of Atlanta for 11 years. When I founded the company, I had one mission, and that was to ensure that Black businesses could accelerate, that the community had fair and equitable opportunities to open in diverse communities, and that we can experience shared prosperity. I can say in the last 7 years, the Village Market has facilitated $7.3 million in direct sales to businesses. I, with partners, have worked with other partners, have invested in commercial real estate in the Castleberry community, built programming for Black businesses, have partnered on the local level and the national level. So what I see and how I know I would serve well this appointment is because it's an opportunity to broaden the canvas to serve greater. Before becoming an entrepreneur, I worked for the Georgia Department of Education as a researcher. I spent a great deal of time looking at programming and looking at
Hallman for stepping up to serve the city. I had a chance to meet you at an event here in the city of Atlanta, and just to hear your passion and all that you've done and accomplished so far in your life. I'm excited to have you in this appointment and work with you going forward. So congratulations.
Thank you.
That sounds like a motion.
Yes. I'll make a motion to approve.
Second by Bakhtiari. Please open the vote.
Vote is open, and the vote is closed.
Motion is adopted, 4 yeas, 0 nays. Thank you so much, Dr. Hallman. Apologies for missing your honorific earlier, by the way, but thank you so much, and thank you for joining us today, and thank you for your continued service to the city of Atlanta, and look forward to serving with you on the Invest Atlanta board.
Thank you.
Also, your energy is fantastic, so excited.
All right. Next item.
Item number 8 is 22C5150, a communication from council members Liliana Bakhtiari, District 5, Alex Wan, District 6, Howard Shook, District 7, Mary Norwood, District 8, and Matt Westmoreland, Post 2 at large, appointing Mr. Joseph Klein to serve as a member of the Atlanta Beltline Tax Allocation District Advisory Committee. This appointment is for a term of 2 years.
Mr. Klein, good to see you once again. Thanks for joining us.
Likewise.
As stated, I think I cut you off. I was going to say, as stated before, tell us a little bit about yourself and why you're interested in this appointment.
Sure. My name is Joey Klein. I am an Atlanta native. I grew up in Sandy Springs, and I currently live with my wife and 2 kids in Morningside. And I come to this with a deep love affair for the city of Atlanta, but one that was really developed after I left and kind of came back. I was absent from Atlanta and living elsewhere for about 8 years, and in that time I saw cities that I thought were doing things that Atlanta wasn't, in regards to preservation, in regards to transportation, in regards to preserving culture. And I came back to Atlanta for graduate school and thought that I would be here for about 2 years and I would go elsewhere. And I came back to a very different Atlanta, an Atlanta that was rejuvenating itself, that was finding value in its hidden treasures in the heart of the city that had been abandoned decades ago. And the Beltline is a big part of that. And the Beltline is a big part of why I decided to stay in Atlanta and raise a family in Atlanta and become a commercial real estate broker in Atlanta, who often interacts with the Beltline and its effect on real estate. And so the Beltline has given me a lot, both personally and professionally. I think it's the greatest thing that is happening in Atlanta right now, and one of the most exciting projects across the entire country. It is an area that I think we lead and can show off to other cities that perhaps in the past would show off to us. And so it's with that in mind that I feel obligated, and of course a desire to, give back. And serving on this committee with my professional expertise in business and real estate, and of course my personal passion as just simply a lover of all things old and urban in Atlanta, it would be an honor to serve, and I'm thrilled to be here today, and I look forward to serving the city of Atlanta and the Beltline well over the next 2 years.
Thank you, Mr. Klein. Before I make a motion, I do want to acknowledge we've been joined by Councilmember Michael Julian Bond. And also, before I make the motion, any questions or comments from colleagues? Well, Councilmember Bakhtiari beat me to the motion. We'll move approval from Bakhtiari, seconded by Dozier. Please open the vote.
The vote is open. And the vote is closed.
A motion is accepted. 5 yeas, 0 nays. Thank you so much, Mr. Klein, and thank you for your service to the city of Atlanta.
Thank you.
All right. I believe that was our last, well, not last communication item, but last item for folks who are actually here for appointments. So we'll move back into the regular agenda, going to presentations. Dr. Lynn Paxson. Good to see you, Dr. Paxson.
Hi. Hello. How are you? Good. My presentation's already been loaded. It has been. Thank you. Can you hear me?
Yes.
Good. All right. Well, thank you very much for inviting me here to give you an update on Fulton County Board of Health activities. Of course, everyone knows that the big things that have been in the news recently, well, for the past 2 years, it's been COVID. For the past 2 months or more, it's been Monkey Pox. I'm going to start off with those. But also, there are other things. So I'll talk a little bit about what the Fulton County Board of Health is doing. So to start off with monkeypox, since that seems to be on top of everyone's mind at the moment, just to give everyone here a brief overview of monkeypox, which, by the way, will soon be changing its name. It's going to be known probably as Mpox rather than monkeypox, because actually, you know, monkeys probably got it from us in the beginning, and it's really felt better to not, you know, to not call it monkeypox anymore. But that is a change that will be coming probably very soon. in the world, this data is about, a couple of days old, but in the world we've got about a little over 56,000 cases of monkeypox. In the U.S., about 21,000. In Georgia, about 1,500 or so, of which most of those are here in Fulton County. So over almost coming up on 700 cases have been here in Fulton County. And so, which is approximately 47% of all of Georgia cases. The other cases have been mostly in the metro area as well. So therefore, in Fulton County, we have also been giving out the most vaccines. And we've given out over 9,000 as of today, and that number is rising every day. Where we are giving that is we're using the Jynneos vaccine, which is a very safe vaccine that can be given even to people who are HIV infected. It's given at 2 doses 4 weeks apart. And our primary standing vaccination place is at the Neighborhood Union Health Clinic. And so we're giving it Wednesdays through Thursdays from 9 to 3. It's a walk-in clinic. Again, though, it is for people who are truly at risk. I'm going to tell a little bit more about the demographics of monkeypox so you can sort of see who is at risk. But this is just a very nice little slide that shows the case trends. We had a really quick rise, but happily, we're starting to see a fall. And so you see it's just basically, it is like your classic bell-shaped curve there. You probably can't see it all that well, but that is showing us who is getting monkeypox here in Fulton County. About 80% are African American males. And the bar on the bottom shows our vaccination efforts. And so we have made really concerted efforts to get these vaccines into the arms of the people who most need them. So about 60, but unfortunately we've lagged. We haven't, not 80% of the people who've gotten them have been African American, but 60% have been, and about 80% have been men of color. Again, I regret the fact that it's kind of hard to see this. If I had known this, I would have made bigger slides. But this is really just showing who is getting, monkeypox in our country. Really, it is like 99% men who have sex with men, and what I really need to emphasize to people, because I get a lot of panicked emails and calls about, from parents, I'm really afraid my kid is going to get it at school or something like that. But that's not the way it's transmitted. It really needs really prolonged contact with someone who has an active lesion. And so therefore, it is associated, therefore, with intimate contact, and we're seeing to this date, it has been about 99% men who have sex with men. So they are our target. In addition, we have found that the people who are most at risk among this group are people who are HIV infected or who've had some other STD. You might have read in the news today that it has just been confirmed that there was 1 death from monkeypox in California. And there's another one that's been reported. From what I've read, both of these were there are privacy issues, of course, but I understand that these people were severely immunocompromised. And so that is probably why that has been. For the most part, though, those are the only deaths that have been, even associated with monkeypox. But it still, is why we need to get people vaccinated for it. So again, you really can't see this. Again, if I ever come back, I will know how, what size to make my slides, because these are kind of useless if you can't see them. But this is basically just tells what happens, at the Board of Health. How do we handle a monkeypox case? So, of course, you can always ask me questions, but I'm going to go ahead and go on to the COVID update. Now, we've been dealing with COVID for a really very long 2 years now. And a lot of people think, it's all gone away and all that. It hasn't. And I'm going to give you sort of bring you up to date on where we are with the state of the epidemic right now. Apparently, my phone is kind of blowing up right now. This just shows, just to remind people, this is sort of the cumulative COVID count for the United States. And we've had about 95 million cases of COVID. And here with over 1 million deaths. In Georgia, we've had about, these are documented cases, about almost 300,000 cases with, I think it's like I can't even read it myself. I'm sorry. It was almost 3 million cases in Georgia with, honestly, I can't even read it, but a lot of deaths, more deaths than there should have been. And in Fulton County, we've had over 250,000 cases and more deaths than we should have had. This just shows you the trends, and so this is the cumulative trend. So it just shows, the mounting number of cases that have occurred since the start of the epidemic, around March of 2020. This one, again, this is kind of one of our money slides, and I'm sorry you can't see it very, very well. But this shows the effect of vaccinations. I don't know if people understand the extent to which vaccines in general are a miracle, but also to what extent they are protecting people here against COVID. What this shows, and I'll just sort of, trust me if you can't read it, that line on the top are the people, it's based on vaccination status. So it is basically deaths based on your vaccination status, whether or not you are fully vaccinated without a booster, which means having had the primary series but no booster, or if you've had the primary series and a booster. And as you can see, that it basically, that vaccines are highly protective against death and hospitalization. So maybe this one might show up a little bit more. Okay, this is somewhat better. This is right here in Fulton County. This is our own data. And this is showing that in our own hospitals, that roughly 92% of the people, 90 to 92% of the people who are being hospitalized and who are dying, because we still have people dying every day in Georgia of COVID, they're unvaccinated. And so you see, that's that orange band there. Those are the people who are unvaccinated. The smaller band of the light blue are people who are only partially vaccinated. They've had maybe their first series, but they've had no boosters. And that very small 3 to 4% are people who have actually had their boosters. And I can tell you that generally those people are aged and they have multiple medical problems, so that there's kind of a reason. But this shows you how very protective the vaccination is. We've done very well at administering vaccines in Fulton County. I'm probably one of the best in the state, for sure. And so we have managed to vaccinate at least 70% of Fulton County residents have had at least one dose. About 64% have had, their first primary immunization. But we're still lagging behind on getting the boosters. I just had my booster today. We have the new bivalent booster out, which has been approved, which is actually a mixture. It's half a vaccine that's targeted to the original strain, and half that's targeted to the B4, B5 strain, which is the one that is now the most prevalent in the United States. And I'll show you a slide of that. But anyway, we have that vaccine. This is the time to get it. We are about to go into cold and flu season, which brings everybody inside, coughing. That's when we do. There's a reason why we see colds and flus go up at that time. We're also bracing for maybe a resurgence in COVID. However, what is kind of protecting us at the moment? These numbers, people getting vaccinated. And so that is a very protective thing to do, not only for yourself, but for the community at large. This is going to show, this is where people ask me all the time, well, where are we right now in terms of our risk level? I have to put a caveat out here. This is a good thing. But there are lots of rapid tests that are out there. We give them out like water at the Board of Health because we want people to test and to know their status. But that doesn't get reported back to us. So we have no idea. And so we now know that the official test results that we have do not reflect what's actually going on out there. We're probably underestimating the number of cases by maybe, 4 or 5 times. We don't know because of the nature of it is. But The CDC has a ranking system that anybody can look at the CDC website, look up under COVID and community transmission, and it'll sort of tell you where are we at the time. And it's color-coded by green, yellow, and orange. We are currently, as of today, we're in the yellow zone, which is in the moderate thing. And that's based on number of reported tests, but also what they're looking at now is the strain on the healthcare system. I don't know if you all remember, because I know people have short memories, about how horrible it was back in January of this year. When Omicron, when Delta first hit us, back in the year before, and then when Omicron came to slap us across the face, we had, overwhelmed hospitals, we had ICUs that were filled. It was an incredible strain. And so now what the CDC does is, instead of looking only at case counts, they also look at strain on the health system. And so this is a combined measure that they use. And right now we're in the mid zone. We're in yellow. And there are specific recommendations, and I urge everybody to go to the CDC website and to see what those recommendations are. But for example, if you're in the yellow zone, it's recommended that if you're going to be inside in a public place, you should probably be wearing a mask, particularly if you have any comorbidities or if you're at greater risk of COVID. I personally just don't want to get COVID. I don't want to get long COVID and all that. So I do wear a mask when I'm out in the public place. But again, all of this information is on the CDC website. It's also on the Fulton County website, so we encourage you to look at it. This is just a reminder about there's still a lot of transmission going on. Red here means high community transmission. Almost all of Georgia, including Fulton, is in high community transmission. So again, that's why you see me here wearing my mask. So even though it hasn't been straining the healthcare system to the extent that prior variants did, because of the fact that now more people have got some level of immunity, there's a lot of transmission going on. This is just showing you, I'm going to be going a little faster now, but this is just showing you that how quickly that the B4, B5 variant has really just taken over everything. That's throughout the entire United States. You can't even see this, so I'm not going to go over it, but it's again, this is a bunch of the measures that we look at, like in terms of the number of hospital beds being used, other things that show us, how much is COVID straining us. Red is bad, green is okay, so. And again, you can't see this, but this is just a list of resources that anybody can go to find out more about, all of the things that I've talked about. Now, what I want to also remind people of, I made mention of cold and flu season is coming. I love to say this, winter is coming. So be prepared. What you should all be doing, because I'm also going to be going to get my flu vaccine later today. You can get the COVID vaccine and the flu vaccine at the same time, not a problem. And it's just a good thing to do because cold and flu season is on its way. As you see here, this is already looking at reported flu cases now, and we're starting to see it. And Georgia's yellow, so green is good, and we're already having cases. So it's a good thing to go ahead and get your flu shot. Now, just to remind you that life is not all infectious diseases. We have other things going on at the Board of Health, and I just want to make sure people are aware of the things that we do and that we have available. So we have, under our medical and preventive services, of course, we're doing all the COVID-19 testing and vaccinations that I just spoke about. But we also have a very robust HIV elimination program. It's usually, people might know it as the Ryan White program. We call it HIV elimination, but it's the same thing. We have a sexual health clinic that has been particularly busy right now with Monkey Pox, but we're there all the time dealing with STIs and HIV-related things. We have a tuberculosis clinic. We see a lot of people with tuberculosis. We have an oral health program for your kids getting that need their school oral health checkups. We do those, but we also treat people, both children and adults. And, of course, we're doing the monkeypox vaccinations. Under our nursing services, that's where we do our immunizations. We have our regular health checks. We do vision, hearing, and dental screenings for kids. We do nutrition screenings, like part of the WIC program. Family planning. And with all the recent Supreme Court proclamations and the overturning of Roe v. Wade, family planning is even more important than it was, in the past. And so we are definitely ramping up our services with that. We have women's health service. We have a breast and cervical cancer program. We do general health promotion. We do have adolescent health and youth development programs. We have pregnancy prevention programs. We have tobacco programs. We do chronic disease prevention, like, hypertension, diabetes, obesity. It's a huge problem in Fulton County. Safe Kids program. We do unintentional injury prevention, car seats and all that. Again, I mentioned pregnancy prevention. We do even a health literacy program, and we worksite wellness programs. Maternal and child health services, and then, of course, we also take in our maternal and child health services. We have like a very sophisticated, hearing booth to test young children, and we have Babies Can't Wait. We have a lot of programs there in conjunction also with the state. And, of course, we are a big provider of the WIC services with the supplemental food vouchers, breastfeeding support, nutrition education, and health care referrals. It is my hope that we're also going to start be able to do more in terms of getting primary care services out to the communities, particularly like with the closing of the Atlanta Medical Center, with the WellStar. The closing even before that of like the only emergency room south of I-20. We have large swaths of our population that have got to travel to get care. And, I think we're looking very strongly into what can we at the Board of Health do just to get primary medical care services out there. So that's huge on our agenda. So anyway, I just tried to, I could talk for a long time, but I'm not going to. But we are continuing, the Fulton County Board of Health is your Board of Health. And so I just want to have you guys know that we're there. We are literally up the street. I walked down here today to come to this. And so we are there to serve. And I hope that this has been, given you an idea of what we do. And also a reminder, get your vaccinations. Vaccinations save lives. Vaccines, I was looking to say yesterday, it's estimated that your childhood vaccines save an estimated 2 to 3 million lives per year worldwide. So I just want to remind people about how very important it is to get vaccinated. So thank you very much.
Thank you so much, Dr. Paxton. I will say, I know you had some concern about the visual quality of the slides. We do have printed copies, so from our perspective, at least many of us were able to still
because I'm so old, I couldn't see that. And then I printed it out very small, so I couldn't even see what I brought with me. So
no worries. And before I turn it over to colleagues who I know have questions, I do want to just ask a few real quick. The first, just recognizing that I do know that the data you shared is county data. Are those people who reside in Fulton County, or those who are treated / admitted into a Fulton County treatment facility?
I'm sorry, for which slide are we talking about? COVID, Monkey Pox, or what?
In general, so all the Fulton County data that you're sharing in general, is that based on people who reside in the county, or is that based on people who are treated in the county?
For example, all the vaccination data is based on where people reside, because we can tell by their thing. But we also look at how many we just give out. So we have sort of two sets of books. We have how many people are Fulton County residents and how many people are from anywhere else. Because, for example, the monkeypox vaccinations, it was our decision. We wanted to make sure that people coming in town for like the Black Gay Pride event, we wanted all of them to get vaccinated. So we vaccinated people from Ohio and all sorts of places. But yes, we do keep records of where people live who are getting vaccinated by us, and also but the hospital data that I presented are for healthcare locations inside Fulton County.
Okay, and then I recognize that Fulton County is a very big county. North Fulton, South Fulton, and city of Atlanta are all very different in terms of our populations, demographics. Are you seeing any sort of trends related to that geographic disparity, or do those trends align with what you presented as far as race and income?
Oh, you're right. I mean, we're almost, this county represents three or more different worlds. Because I don't have I can't keep you here listening to me for hours, I didn't bring all the slides that show all this. But are there disparities? Absolutely, there are. There's disparities in the actual illnesses that people have. There's disparities in the access to care that they have. There's even disparities in terms of vaccinations and cases. So, yeah, I mean, there is. I just didn't present all that data because you would all stand up and walk away because I'd be talking and talking and talking.
No worries. I was just really curious about that, just recognizing, too, I think where we physically place some of our treatment facilities, for instance, can potentially have an impact. And
yeah. We need more in the South now.
Yeah.
All these recent closures, high-profile closures, yeah.
Absolutely. One of the things I also think about, too, so I have a 2-year-old at home. She just got her second vaccination for COVID.
Good for you.
And well, one of the things I am curious about is for the under 5 population, what is that vaccination rate looking like, especially since that's the newest vaccine that is out and available, and whether or not we see a misalignment in vaccination rates based on some of the spatial disparities I mentioned before, as far as the type of communities, racial dynamics, and things like that, and what our offices as council members can do to try to address that disparity, assuming it does exist, so we can encourage our constituents and our parents that live in our neighborhoods to get their kids vaccinated.
Well, yeah. Well, yes, as for some of the reasons you've mentioned, we are seeing a disparity because, of course, the vaccines for the younger age groups were approved much later than for others, and so they simply haven't had enough time to do that. The other thing is, it is. This is a good thing, and children tend to not die, from COVID at the rates that I would or an 80-year-old would, and all that. Their mortality rates are definitely lower, and so. There are some people who haven't, I think, that probably factors into, I'm not going to get my child vaccinated because they're not going to die of it. Which, I think is very short-sighted because some kids have died. Some kids have gotten, this particular inflammatory syndrome, which, it's, again, maybe it's less than maybe 1,000 people, 1,000 kids, but if you get it, it's very bad. And we're starting to see kids with long COVID, which is, to me, horrifying that we're doing that. And, of course, the virus doesn't discriminate. If it infects a small child, that small child can then go and infect grandma or so it's for the community illness prevention scenario, it's a good idea to get people vaccinated. So we are making, we're making a concerted effort to make this available to everyone out there. And so we're working with the schools to offer vaccinations. Primarily, most of the vaccinations of small children that are being done at the pediatrician's offices, which I think is great, because these pediatricians, they know their own patients, they're accustomed to working with small kids. And so we at the health department, we do vaccinate children, but not to the extent that that pediatricians do with their own patients, again, which I think is a good thing.
Oh, thank you for that. And, I'll ensure that my team and our office is looking out for these sorts of initiatives that y'all are doing, because we want to make sure we're doing our part to get the word out, get our constituents connected to the endeavors that y'all are doing and the efforts that y'all are doing and the programs that y'all have. So I just really appreciate that and just want you to know that we want to be allies.
Well, that's great. So if you could just encourage people, the vaccine, the boosters are out. So I think it's my personal belief is that we're going to end up with, we're probably headed towards having a once-a-year COVID vaccine, have a once-a-year flu vaccine. That's probably what we're going to that's probably what we're headed for right now. But at the moment, we're not there yet. I'm encouraging everyone to get vaccinated because winter is coming.
Thank you so much.
Okay.
That was my last question. I'll go ahead and give my colleagues an opportunity to ask questions. Councilmember Bakhtiari.
Thank you so much for coming in. And I apologize for stepping out for a moment to having to handle a minor emergency. Is Fulton, are you all still involved in the observation of wastewater to predict outcoming?
Well, it's not necessarily predicting, it's sort of monitoring. Yeah, yes, we are.
Are we able to, I believe, did we not partner, from my understanding, the way it was described to me when the initial, I think the Rockefeller grant came through, or the Rockefeller Foundation helped with the initial grant, was that they were able to predict when a surge might occur by observing or monitoring the wastewater?
Well, yeah, we're working particularly with Emory University and with another group. The Georgia Department of Health is working with with another group to monitor in various sections of Fulton County. And that's another reason why I can say with confidence that our official test results don't really reflect the amount of COVID that's out there, because our wastewater is showing, lots of COVID, out there, which we, even more than we'd expect if you went just by the official PCR, verified, tests. So we know that there's still a lot of COVID out there. But happily, and again, we're not seeing as many people, actually in the hospital are being really super sick with it, because so many people have been vaccinated, and so many people, unfortunately, have a lot of people got COVID and died, over a million people in the United States, but many got COVID and did not die, and they have some level of short-term immunity from that too. So that's probably why we're not seeing huge numbers of people in the hospital. But there's a lot of COVID out there. Don't get me wrong.
Oh, I would imagine so. Doesn't exactly help that media portrays the pandemic as almost pretty much being over.
I know. People will come to my face and say, "Why are you wearing a mask? COVID's over." I said, "No, it's not." And I don't want to. I've never had COVID. I'm going to do my best to not ever get COVID.
And I was confused. The timing for the new vaccine. You're saying that we should wait until.
No. Okay. Here's what the official recommendations are. If you are more than 2 months from your last booster or from having been infected, then you're eligible to get a booster now. Okay. I mean, it's pretty simple. So if you're 2 months out, you can go get your booster.
Okay, thank you. And then I was curious, you were mentioning with the certain closures that were taking place, especially closures with a lot of media attention.
Oh, sorry.
Were you all able to weigh in at all on the AMC closure before it took place?
Oh, no. Nobody weighs in on it. No, but they didn't ask us. I mean, that's not the sort of, I do not know what the reasons were behind it. I've heard on news it's financial and all that, but no, we were not consulted about that.
Yes, financial when it happens to be in two of the lower income parts of town, but yet the North Fulton areas are still remaining open. I would say that's certainly financial.
Yeah.
I was wondering if there had been any opportunity to monitor what the impacts might be with the surges, with everything that we're facing with the monkeypox reports that you just gave with the closure of AMC.
Sorry, if we had a chance to.
If there's any predictions on impact that we should be better prepared for, because one of the questions I've had repeatedly in my district is, what can we do? And a lot of folks, there is nothing I can do. I don't have purview over that, and I've had to explain that. But is there something that we can do to prepare for what might potentially occur due to this closure and the lack of medical attention that people are going to receive as a result?
We probably can. It's funny that this should all come up today, is that I think it's already apparently straining the EMS system. Mm-hmm. Right before I came over here, we had a person at 10 Park Place in our clinic have a seizure. And so they called the EMS services, and the EMS service says, we can't tell you when we can come. When I left to come down here, the person was still in our clinic, being looked at by one of our, watched over by one of our doctors, but EMS had not arrived. So I basically got in touch with the county manager and said, what's going on? He says, well, we have to, he says, there's diversions taking place because of what's going on with the various hospitals. So I think that they're going to be working with the state, to figure out how to improve the EMS system. But I think this is probably just a harbinger of things to come, because it only makes sense. If you remove places where people are seeking care, if you close them down, those people are not going to stop getting sick. So they have to go out, they have to seek care, we have to provide care to them elsewhere. And so that's why I said for the Board of Health, one of our big pushes is going to be to see what can we do from our standpoint to get at least more primary care out into the communities to be I always wanted to do this, but I think it's more pressing now with these various entities that are closing. I wish I could wave a magic wand and have a full-service hospital, appear in the place, but that's beyond any one person's purview. But I think we can certainly work together and politically, to work with the state, maybe with the governor's office. I mean, I think there's a role for government to step in when large swaths of the population are not being served. But that's my belief. But.
Well, I appreciate your belief. I'm of the same mindset. And I was curious, I know that this has been monkeypox situation has been a rapidly evolving pandemic, so I was curious as to if the Fulton County Board of Health had any opportunity to do any type of fiscal impacts whatsoever on what had been evolving from monkeypox, what we're now facing.
No, we haven't done any specific.
We're currently working on trying to do that in better preparation. I'm trying to gather more information. Is that at all on the timeline for you all, or
for us to figure out how much we've spent on monkeypox?
On what it's costing currently and what we can do to better prepare?
Well, there are certain things, in a more general sense, we in public health have known for a long time that it's never a question of will there be another pandemic, it's when and what will that pandemic be, So that is going, and one thing that, for example, the CDC is doing, in fact, we are in the middle of doing the application, is they are setting out to do pre-funding for the next pandemic. So it's basically like a pre-approval process for, boards of health and other entities for when the next public health crisis comes along. That then the process would then be streamlined because you've already been pre-approved for money from the federal government. So we're going through that right now so that we can be one of those. I think they've got 80. They told us specifically that we're in big bold letters. Fulton County is eligible to apply, so we're doing it right now for the next pandemic. But about monkeypox in particular, I can't really tell you how much we have.
Understood. And that I've kept you long enough. Those are all my questions. Thank you.
Welcome.
Councilmember Bakhtiari. Before we move on to Councilman Ramus, I do want to acknowledge we've been joined by Councilman Matt Westmoreland. All right, Councilman Ramus.
Good afternoon, Dr. Paston, and I realize this may not be within your purview, but you mentioned Neighborhood Union Health Center, which is not only in the district, but in my neighborhood that I actually visited as a child growing up. What is the status of our health centers? I know several months ago it was reported that Fulton County was, giving them all to the state of Georgia. Did that happen? What does that look like?
No. I think when you say giving it all, I think what you're conflating as a separate issue is that there are 59 counties in the state of Georgia, and for some reason Fulton County Health Department was the only one that was underneath the county and not the Georgia Department of Public Health. So back in 2017, the legislature said that had to be fixed, and it was just last year that we kind of fixed that. So so we no longer are like Fulton County employees, we are Georgia Department of Public Health employees. So that was the alignment. But it had no effect on any of our health centers. It was really more of an administrative, move. But it had no effect on all of our. We are making changes because we have to change and evolve as things, as things come up. But they're still, all our health centers are still functioning the way they were before we made the administrative change.
And you also gave us a lot of information about the services, but very little information about the location of services.
Yeah,
that's something you could get to.
Well, what I could do is I would direct everybody. In fact, our new website Our old Fulton County Board of Health website crashed back when the COVID vaccines first came out. It couldn't handle the sheer volume of people on the site. So we moved to the Fulton County website. But now we are next week going to be launching back to having our own Fulton County Board of Health website. And on there, it's it's got a list of all of our health centers. And it will even have a function where you can make appointments on the website at different ones. So what I'm going to do is encourage people to go to check out our website and to see all of our different health centers and what services are available at which health centers.
Thank you, Councilman Amos. Councilman Winston.
Thank you, Mr. Chair. Thank you, Dr. Paxton, today for this thorough update from Fulton County. You kind of answered my question. Councilmember Bakhtiari asked about the boosters. In terms of the boosters, what are we seeing in terms of, are we seeing hesitancy from people, or is there confusion around, who should be getting it and whatnot? I know there was also confusion around, is there a new booster coming out? And is that one more effective, for new variants that are coming in the future? I just wonder if you could clear the air on some of those questions.
I think that the expectation is that this new, more tailored booster, which is specifically aimed at the variant that's circulating right now, by right should be more effective. We don't know that yet because we haven't given enough to enough people. What this is being based on. Laboratory studies and looking at antibody levels after the boosters have been given, animal studies and all that. But I can't definitively say what the effect is going to be in humans until we've given it to enough humans. But the thing is, as I said, partly it is very similar to the other vaccine that we now have 2 years worth of experience with, except it's got a component that's even more targeted for this new variant. So my expectation is, everyone's expectation is that it should be fairly effective. The problem with boosters is the same problem we have, like we've had for years and decades with the flu vaccine. A lot of people think, I don't need it, and so that's why we have much lower rates. We have 70% of Fulton County residents have gotten one vaccine, at least one vaccine, but whereas only 33% had gotten a booster. So that's why I'm always, encouraging people to, get that booster, because what we have found is this virus is a lot smarter than we are, and it does mutate a lot. The way to stop a virus from mutating is to have fewer people getting infected in the first place. So I'm really encouraging people that for their own health, to cut down on their risk of ending up in the hospital and of dying, get a booster. But it also helps with transmission, because it has been shown that people who are boosted are less likely to get infected in the first place, and therefore less likely to pass it on. The fewer times we pass it on, the fewer opportunities we give the virus to mutate and form something that's going to keep coming back at us.
Great. And so the other question, Councilmember Dozier talked about his daughter having the 2 shots. My daughter just got her 3rd.
Good for her.
It's a long process. It takes a while.
It's not a race.
I know. But it's a long process, and you're seeing the lag in people even getting fully vaccinated, because most of the vaccines require 2 shots. It seems that could also be a concern with adolescents, because it takes so many months to be fully vaccinated. Is there an education process to help with this?
I'm sorry, it takes to be fully, you mean in terms of getting people to come back in? We know that you are considered fully vaccinated 2 weeks after your second dose. But are you saying it?
So two things. One is adults getting the vaccination, needing 2 shots. Yes. We're seeing that the numbers are lagging behind from adults getting fully vaccinated, because it is taking 2 shots. So most are getting 1 shot, just based on the data that you share with us. This process is also taking longer with adolescents and children, because it's several months, and I think Pfizer is 3 shots, Moderna is 2, and it's taking a longer time. So is that a concern for you all, that seeing children and adolescents being vaccinated, that it's such a long, drawn out process?
Well, I actually, to be honest, you're actually the first person who's brought that up to me about it being, it's such a long process, because most of the parents that I speak to, I mean, they come in for their first shot and then they make their appointment for 3 weeks later for the second shot, and they come and it gets done. But obviously, our dream vaccine would be a one-dose vaccine, one and done, lasts for the rest of your life, boom. But that's not what we have. So you, as I think some defense minister, you fight with the army you have, not with the army you wish you had. And that's what we have. So what we are trying to do is we try to make it as simple as possible. So that's why you can now just walk into any of our health centers and get vaccinated. You don't even need to make an appointment. You just show up. We are having more clinics that are open at night, so that people can, bring their kids in. And we work, as I said, with the schools. So we're having lots of school vaccination clinics with the kids at the school. So we're trying to do what we can to make it as simple as possible.
We appreciate all your work, and I guess Chairman and I are doing our job in as much as possible to keep our kids from spreading it. So
yeah,
thank you.
Thank you, Councilman Winston. Any other questions or comments from colleagues? Seeing none, thank you so much, Dr. Patterson. Thank you for joining us today. All right. Next up on the agenda, we're back to communications. I believe we have 2 items that need to be held.
Would the committee like to take those as a block? We can hold them together.
Seeing no objection from my colleagues, go ahead.
Item number 2 is 22C5144, a communication from council members Howard Shook, District 7, Mary Norwood, District 8, and Matt Westmoreland, Post 2 at large, appointing Mr. Michael Golden to serve as a member of the Atlanta Urban Design Commission in the lawyer category. This appointment is for a term of 3 years. Item number 5 is 22C5147, a communication from council members Liliana Bakhtiari, District 5, Alex Wan, District 6, Howard Shook, District 7, Mary Norwood, District 8, and Matt Westmoreland, Post 2 at large, appointing Ms. Natalie Kaiser to serve as a member of the Atlanta Beltline Affordable Housing Advisory Board. And this appointment is for a term of 2 years.
Thank you. Motion to hold. Second by Westmoreland. Please open the vote.
Vote is open. And the vote is closed.
Motion to hold is adopted, 5 yeas, 0 nays. I think that moves us into the consent agenda. Ordinances for first reading. Please move to the first item. I think that's item number 9.
Item number 9 is 22-1731, an ordinance by Community Development Human Services Committee to amend ordinance number 20-0-1216 to correct the account string and associated funding information and for other purposes. Item number 10 is 22-0-1732, an ordinance by Community Development and Human Services Committee authorizing the mayor on behalf of the Department of Parks and Recreation to accept a reimbursement grant from the Georgia Recreation and Parks Association in the amount not to exceed $300,000.00 in accordance with Section 2-910 of the Atlanta Code, and authorizing an amendment to the fiscal year 2023 intergovernmental grant fund budget to anticipate and appropriate, and authorizing the mayor or his designee on behalf of the city of Atlanta to enter into a memorandum of understanding with the Georgia Recreation and Park Association and for other purposes. Item number 11 is 22-0-1733, an ordinance by Community Development and Human Services Committee to adopt the 2023 through 2027 capital improvements element, CIE, which includes capital improvements that the city intends to fund in whole or in part with development impact fees in compliance with the requirements of the Georgia Development Impact Fee Act and for other purposes. Item number 12 is 22-0-1734, an ordinance by Community Development and Human Services Committee waiving the requirements of Chapter 2, Article 9, Division 1, Section 2-910 of the Code of Ordinances of the City of Atlanta, Georgia, and authorizing the mayor or his designee, including the Commissioner of the Department of City Planning, to apply for a community composting and food waste reduction pilot project grant from the U.S. Department of Agriculture in an amount not to exceed $300,000.00 in order to create and test plans for organizing and carrying out municipal composting programs and food waste reduction programs, and to enter into any necessary agreements for the acceptance and implementation of the grant if awarded and for other purposes.
Thank you. That will move us into the next item of the agenda, or regular agenda, being the ordinances for second reading. Before we move to take on item number 13, I know we have a number of folks speaking to very specific items on the agenda. Mr. Boss, Ms. Lancaster King, Ms. Lavender, if you could, we tried to move things around to keep y'all up, and that way you don't have to get up and down. But there's a lot of items on both the ordinance side of the house and the resolution side of the house, so there was really no way around it. So just to save you a few steps, would recommend you sit up front just so you're ready to go. On that note, item number 13, I believe Ms. Lavender is going to speak to it, but if you could sound the caption, and then we'll go from there.
Okay.
Actually, these are I think that we're gonna try to take these as a block.
So would the committee like to take as a block number 13, 14, 16, 17, and 45?
Seeing no consternation from the committee, I say let's go ahead and move forward with that.
So item number 13 is 22-01653, CDP 22-024, an ordinance by Community Development Human Services Committee to amend the land use element of the 2021 Atlanta Comprehensive Development Plan so as to redesignate property located at 576, 580, 582, and 582 rear Lindsay Street Northwest, and the parcel numbers indicated here from the low-density residential land use designation to the mixed-use medium-density land use designation and for other purposes. And then item number 14 is 22-01654, CDP 22-025, an ordinance by the Community Development Human Services Committee to amend the land use element of the 2021 Atlanta Comprehensive Development Plan so as to redesignate property located at 1314 Murphy Avenue Southwest from the industrial land use designation to the mixed-use land use designation and for other purposes. Item number 16 is 22-01656, CDP 22-027, an ordinance by Community Development Human Services Committee to amend the land use element of the 2021 Atlanta Comprehensive Development Plan so as to redesignate property located at 554 University Avenue Southwest from industrial land use designation to the mixed-use medium-density land use designation and for other purposes. Item number 17 is 22-01657, CDP 22-029, an ordinance by Community Development Human Services Committee to amend the land use element of the 2021 Atlanta Comprehensive Development Plan so as to redesignate property located at 569 Amsterdam Avenue Northeast from the single-family residential land use designation to the low-density residential land use designation and for other purposes. And finally, item number 45 is 22-01426, CDP 22-028, an ordinance by Councilmember Alex Wan to amend the land use element of the 2021 City of Atlanta Comprehensive Development Plan so as to redesignate property located at 1195 University Drive Northeast, Atlanta, Georgia, 30306 to the single-family residential land use designation and for other purposes.
Thank you. Lavender.
Yes, thank you. Jessica Lavender with the Office of Zoning and Development, and I can give staff recommendation on all of these. So the first one is on Lindsay Street, and this is 2.7 acres of vacant land that will be used by the Peace Preparatory Academy temporarily for classroom use while their classroom is being built across the street. And after that, it will be developed with affordable housing. And this is consistent with the West Side Land Use Framework Plan that recommended diverse and sustainable communities that values and promotes family education and the environment. So staff recommends approval of this land use amendment. It's on our character area is a traditional neighborhood redevelopment, so it was consistent with the policies to promote infill development on vacant lots and encourage the compatible development within the neighborhood. The NPUL also recommended approval of this land use amendment. The next one, CDP 2225, is on Murphy Avenue, and it's currently occupied since 1999 by Scenario Custom, and that's a business that fabricates studios, film, television, architecture services, and things like that. And there are several plans adopted in this area, including the Oakland City for McPherson LCI and the Beltline sub-area too. In both plans, the vision is to continue industrial use, to promote more worker spaces in Murphy Triangle and bring jobs to the area that meets the needs of the residents. Both plans recommend iMix for this parcel so that there's opportunity for jobs to continue. Maybe Scenario wants to move, but there's opportunity for another business to locate there and keep jobs in the neighborhood. So staff recommends denial of this land use amendment. The proposed multifamily residential is not compatible. If iMix would allow for residential and jobs to continue on this site. So staff recommends denial of this land use amendment. This was before NPUX, and they voted to support that land use amendment. The next one is CDP 2227 on University Avenue. This is in the Pittsburgh neighborhood. It's a 2.1 acre parcel. This was in the Pittsburgh. This parcel was included in the Preservation of Pittsburgh plan. The plan recommended, infill residential, stabilizing residential in the Pittsburgh neighborhood north of University, having commercial uses along Metropolitan, but retaining the parcel south of University for industrial uses, for jobs for the people that live in the community. And as you know, the Pittsburgh Yard is being redeveloped, and this is adjacent to that. So the plan recommended, it said that this area would benefit from introduction of a green business, something that could have sustainable uses in the future. Our comprehensive plan recommends industrial for this parcel. The applicant is proposing townhomes there and some live work, so that is not consistent with the Preservation of Pittsburgh plan. It's also in the Beltline sub-area 2 plan, and as you know, one of the efforts of the plan is to bring jobs to this sub-area of the Beltline that meets the needs and the educational attainment of the neighborhood. So staff recommends denial of this land use amendment. We feel that iMix or something that brings jobs would be more consistent with the use, consistent with the recommendations of both plans. This was before NPUV, and they also voted to approve this land use amendment. The next one is on Amsterdam Avenue. The applicant proposes to build a duplex on a vacant piece of property that was formerly developed with a single-family home. This is in the Virginia Highlands neighborhood. It's close to Amsterdam Walk, and we recognize that Amsterdam Walk is a mixed commercial area. There is a building that provides a transition between Amsterdam Walk and this parcel. All parcels on the south side of Amsterdam have a single-family residential land use in our zone R4. They're developed with single-family home. There's no low-density residential on that block, and we feel that this is not appropriate use for this location. There are other places in Virginia Highlands where, more dense housing has been identified, and it's recommended by the Virginia Highlands Civic Association, the Virginia Highlands Plan. So staff recommends denial of this land use amendment. This was before NPUF, and they voted to support that land use amendment. The last one on University is an annexation. It's a single-family home that has a single-family land use in DeKalb County. So when the recommendation is when it's annexed into the city for it to have a single-family residential land use, and staff recommends approval of that land use amendment. So if you have any questions.
Thank you, Ms. Lavenier.
Yes.
Before I open the floor to colleagues to ask questions or provide comments, just want a point of clarification. I recognize that staff recommended denial, recommended support, depending on the different item. But on all the items presented just now, the NPU voted in support of those items. Is that
That's right. Mm-hmm.
And then also, all of these particular items are looking to increase density in that particular, for those particular locations, which is why they're asking for the land use change?
Well, so we have a compatibility requirement. So if somebody's going to ask for a rezoning, it has to be compatible with the land use. So some cases, the zoning doesn't require land use amendment. In these cases, the zoning that was being requested was incompatible with the current land use. So that's why we have a land use amendment.
Oh, understood. I just want to,
Yeah.
just for edification for the committee,
Yes.
this density is still kind of really the focus of all these different, I know like the single family parcel that's going to be proposed duplex, or the live work playoff university. Just want to.
So it's a change of use, right? So I don't know if you would think that a townhouse is more dense than an industrial
That's
use.
fair.
So it's a change of use.
That's fair.
Yes.
I just wanted to share that for the committee as we are taking these as a block.
Yes.
Just something to take into consideration, especially recognizing that my recommendation would be to approve, but I just wanted to share why. It's because as we look at addressing our city's housing challenges, but also looking at the fact that these receive community support, at least through the NPUs, I do recommend support, but wanted to give y'all an opportunity to ask questions if y'all have any before I make a motion. All right, with that, I'll motion to approve just based on just what we discussed earlier. Second by Bakhtiari. Please open the vote.
The vote is open.
Motion is favorable, 6 yeas, 0 nays. All right, next item.
Item number 15, 22-01655. CDP 22-026, an ordinance by Community Development Human Services Committee to amend the land use element of the 2021 Atlanta Comprehensive Development Plan so as to redesignate property located at 706 and 708 McDonough Boulevard Southeast from the single-family residential land use designation to the high-density residential land use designation and for other purposes. There's a substitute in your packet. The substitute changes the switching from single-family land use designation to the high density, rather than it changes it to medium-density residential land use designation and for other purposes.
I'll make the motion brief for the substitute. Second by Westmoreland. Please open the vote.
The vote is open. And the vote is closed.
The motion to bring forth the substitute is approved, 6 yeas, 0 nays. And from my understanding, this item still hasn't made it through zoning, so we'll need to actually hold this. Is that correct? I'll move to hold as substituted. Is that the correct phrasing? Second by Westmoreland. I guess the parliamentarian's here with us today. I got it. All right. I'll take it. Please open the vote.
The vote is open. The vote is closed.
Motion to hold is favorable, 6 yeas, 0 nays. Next item.
The next several items are CDP items that need to be held because they need to work their way through the process. Would the committee like to take items number 18, 19, 20, and 21 as a block?
Any issues from the committee? Seeing none, let's go ahead and do that.
Item number 18 is 22-01658, CDP 22-030, an ordinance by Community Development Human Services Committee to amend the land use element of the 2021 Atlanta Comprehensive Development Plan so as to redesignate property located at 2285 Alvin Drive Northwest from the low-density residential land use designation to the medium-density land use designation and for other purposes. Item number 19 is 22-01659, CDP 22-031, an ordinance by Community Development Human Services Committee to amend the land use element of the 2021 Atlanta Comprehensive Development Plan so as to redesignate property located at 3460 and 3470 Cascade Road Southwest from the low-density commercial land use designation to mixed-use, medium-density, and office institutional land use designation and for other purposes. Item number 20 is 22-01660, CDP 22-032, an ordinance by Community Development Human Services Committee to amend the land use element of the 2021 Atlanta Comprehensive Development Plan so as to redesignate property located at 241 and 253 Boulevard Northeast, 239 and 240 Howell Street Northeast 487, 491, 495, 499, 505, 509, 515, 519, 523, 533, 539, and 545 Highland Avenue Northeast, and the parcel numbers indicated here from the medium-density land use to medium-density residential, from the medium-density residential land use designation to the mixed-use and land use designation and for other purposes. Finally, item number 21, 22-01661, CDP 22035, an ordinance by Community Development Human Services Committee to amend the land use element of the 2021 Atlanta Comprehensive Development Plan so as to redesignate property located at 1185 Irish Street Southwest from the single-family residential land use designation to the mixed-use, low-density land use designation and for other purposes.
I'll move the hold.
Second.
Second by Westmoreland, second by Winston. Got my W's backwards. Please open the vote.
Vote is open. And the vote is closed.
The motion to hold is favorable, 6 yeas, 0 nays. Next item.
Item number 22 is 22-01689, an ordinance by Community Development Human Services Committee amending the fiscal year 2023 budget by adding to anticipations and appropriations reimbursements in the amount of up to $650,000.00 from the state of Georgia in connection with the Bright from the Start Child and Adult Care Food Program for the purpose of reimbursing the City of Atlanta for its after-school meal program on behalf of the Department of Parks and Recreation, and authorizing the mayor or his designee on behalf of the City of Atlanta to enter into any necessary agreements in conjunction with the after-school meal program and for other purposes.
Deputy Commissioner Voss, thanks for joining us.
Good afternoon, Chair Dozier and members of council. We have been here before with this grant. Every year, the state of Georgia, through the Bright from the Start after-school adult and child meal program, up to $650,000 for our hot meal program. Currently, we offer up to 1,500 hot meals and snacks to children across the city at 19 after-school sites daily. This grant would, in effect, allow us to accept the reimbursement and set up the account strings for the 22-23 academic year. Thank you.
Questions or comments from committee? I'll move approval. Second by Bakhtiari. Any discussion? Seeing none, please open the vote.
The vote is open. And the vote is closed.
Motion is favorable, 6 yeas, 0 nays. Next item.
Next item is item number 23, 22-01701, an ordinance by Councilmember Andrea L. Boone authorizing the mayor or his designee to, on behalf of the Atlanta Workforce Development Agency, also known as WorkSource Atlanta, to accept a Workforce Innovation and Opportunity Act Youth Program grant in the amount of $937,159.00 from the Technical College System of Georgia Office of Workforce Development to authorize the Chief Financial Officer to amend the FY23 Job Training Grant Fund budget by adding to anticipations and appropriations the amount of $937,159.00 and for other purposes. There's a substitute in your packet. The caption remains the same, but it corrects account strings.
I'll move to bring forth the substitute.
Second.
Second by Bakhtiari. Please open the vote.
The vote is open. The vote is closed.
Motion to bring forth the substitute is adopted, 6 yeas, 0 nays. We have with us Amy Lancaster King with Invest Atlanta, with WorkSource Atlanta. Thanks for joining us.
Thank you for having me. This is just our youth grant for this program year, and so it's standard money that we're getting from Workforce Innovation Opportunity Act through TCSG.
Any questions or comments from colleagues? Seeing none, I approve to move on substitute. Second by Bakhtiari. Please open the vote.
The vote is open. And the vote is closed.
This is favorable on substitute, 6 yeas, 0 nays. Next item.
Item number 24 is 22-01702, an ordinance by Councilmember Andrea L. Boone waiving the requirements of Chapter 2, Article 9, Division 1, Section 2-910 of the City of Atlanta Code of Ordinances and ratifying the actions of the Department of City Planning, Office of Housing and Community Development, and applying for a grant award of membership in the Putting Assets to Work Incubator program led by the Government Finance Officers Association, a 501c6 nonprofit organization pursuant to which the City of Atlanta shall receive professional services to aid in the leveraging of the City of Atlanta's existing public assets in an innovative way to fund key local initiatives within the jurisdiction valued in an amount not to exceed $500,000 to authorize the mayor or his designee to execute any agreements to effectuate the acceptance of this award, which requires matching funds in the amount of $50,000. All contracted work will be charged to and paid from the fund department organization and account number listed herein and for other purposes.
We have Mr. Matthew Bassel, who is the Assistant Director for the Office of Housing and Community Development. Thanks for joining us today. If you could speak to this particular item.
Yeah, so this is, it's the Putting Assets to Work Incubator, which I'm going to call PAWS for short. So the City of Atlanta was selected among 6 finalists by the Government Finance Officers Association, the Sorensen Impact Institute, and Urban 3 to participate in this year-long incubator program. The Putting Assets to Work it basically means over the next 12 months, we're going to be working with this group of experts and consultants to plan and identify underutilized city-owned assets that could be suitable for private investment or redevelopment, with the expectation that redevelopment would reap social and environmental benefits to the community, primarily affordable housing and improving the city's finances through redevelopment of these properties. As the legislation mentions, this is matching funds that we're submitting as a grant. So the Sorensen Institute is helping us basically match the $50,000 that we're going to be contributing. We're very excited at the Office of Housing and Development to have a chance to work with some of the folks, including former Representative Ben McAdams, who's also former mayor of Salt Lake City, who is leading the group. Salt Lake City is a world-class leader in putting assets to work, so they've been able to accomplish quite a bit of taking underutilized vacant land, sometimes just property that isn't necessarily being used adequately, and generating surplus of funds to fund things like affordable housing, parks, childcare, police, you name it. So we're excited to take part in this. And effectively, this is a continuation of the mayor's efforts at the Affordable Housing Strike Force to leverage our public land to deliver tangible benefits to City of Atlanta residents.
Bless you. And you said it's a national program?
Yeah.
Do you know who the other finalists are? Out of curiosity?
Let me pull it up. Got it right here. So Chattanooga is one of them. Cleveland, Harris County, Texas, so Houston, the city of Lancaster, California, and Annapolis, Maryland.
Is this the first time they've done this sort of opportunity? So
yeah, and this is a continuous. So we've been previously working with Urban 3 and the Sorensen Group as part of the first round of the Affordable Housing Strike Force. So I think we were kind of the guinea pig for this, and based off of the success of that first round, they've launched this program. So unlike the other 5 groups, we've already started our work with these people. So we're just really continuing that momentum.
The eyes of the nation are upon us, essentially. So.
Yeah, I think that's a good way to put it. Yeah.
Any other questions or comments from colleagues? Seeing none, I'll go ahead and move approval. Okay, a second? Second by Winston. Please open the vote.
The vote is open. And the vote is closed.
Motion is favorable, 6 yeas, 0 nays. Next item.
Item number 25 is 22-01703, an ordinance by Councilmember Andre L. Boone authorizing the mayor or his designee on behalf of the Atlanta Workforce Development Agency, also known as WorkSource Atlanta, to accept a Workforce Innovation and Opportunity Act Dislocated Workers Program grant in the amount of $283,891.00 from the Technical College System of Georgia Office of Workforce Development, to authorize the Chief Financial Officer to amend the FY23 Job Training Grant Fund budget by adding to anticipations and appropriations in the amount of $283,891.00 and for other purposes. Again, there's a substitute in your packet. The caption remains the same, but account strings are corrected.
I'll go ahead and move to bring forth the substitute. Second by Bakhtiari. Please open the vote.
Vote is open. And the vote is closed.
The motion to bring forth the substitute is adopted. 6 yeas, 0 nays. Ms. Lancaster-King.
This is our dislocated worker funding. It will come in 2 tranches. This is the first smaller tranche. The larger tranche will come later. But this again is, we've got adult, youth, and dislocated workers, so this is the dislocated worker funds.
Thank you. Any questions or comments from colleagues? Seeing none, I'll go ahead and move to approve on substitute. Second by Winston. Please open the vote.
The vote is open. And the vote is closed.
All right, this is favorable on substitute. 6 yeas, 0 nays. Next item.
Item number 26, 22-0-1706, an ordinance by Council Member Marcy Collier Overstreet authorizing the mayor or his designee on behalf of the Atlanta Workforce Development Agency, also known as WorkSource Atlanta, to accept a Workforce Innovation and Opportunity Act adult program grant in the amount of $130,265.00 from the Technical College System of Georgia Office of Workforce Development to authorize the Chief Financial Officer to amend the FY22 budget by adding to anticipations and appropriations the amount of $130,265.00 and for other purposes. There's a substitute in your packet. The caption is the same, but the account strings are corrected.
I'll move to bring forth the substitute. Second by Winston. Please open the vote.
The vote is open. The vote is closed.
Motion to bring forth the substitute is adopted. 6 yeas, 0 nays. Ms. Lancaster-King.
Our third one, adult population. This is what we do. This is the money that helps us serve the adult population. Again, this will come in 2 tranches. This is the smaller tranche. The later tranche will hopefully come in November, December, January timeframe.
Thank you. Any questions, comments from colleagues? Seeing none, I'll move to approve on substitute. Can I get a second? Second by Westmoreland. Please open the vote.
The vote is open. And the vote is closed.
This is favorable on substitute. 6 yeas, 0 nays. Next item.
Item number 27 is 22-0-1707, an ordinance by Council Member Jason Dozier authorizing the ratification of services rendered by Stanton and Worthy LLC during the period from March 1, 2022 through August 31, 2022 for the purpose of on-the-job training for Workforce Innovation and Opportunity Act eligible individuals, to authorize the mayor or his designee to execute an agreement for on-the-job training agreement with Stanton and Worthy LLC on behalf of the Department of Atlanta Workforce Development Agency, Workforce Atlanta, for the term of 5 months, retroactively commencing March 1st, 2022, and ending on August 31st, 2022, in an amount not to exceed $15,000.00. All contracted work will be charged to and paid from the Fund Department organization and account numbers listed herein and for other purposes.
And we don't have a substitute for this one, so I'll go ahead and hand you the floor, Ms. Lancaster-King.
So this is for our on-the-job training program. Stanton & Worthy is one of our employer partners. Part of the way that program works is they have to meet a minimum threshold wage-wise, so the person has to make a livable wage within the city of Atlanta. We subsidize those wages for up to 6 months, and that during that period they take someone that needs significant onboarding and dedicated training during their first 6 months to make them fully equipped employee, and so that's what this program is for. And so the $15,000 is for reimbursement of wages.
Thank you. I'll go ahead and move approval. Second by Bakhtiari. Any discussion? Seeing none, please open the vote.
The vote is open. And the vote is closed.
Motion is favorable. 6 yeas, 0 nays. Next item.
Item number 28, 22-0-1710, an ordinance by Councilmember Antonio Lewis authorizing the mayor or his designee or the chief procurement officer or their designee on behalf of the city of Atlanta to purchase approximately 3.65 acres of real property located at 3724 Forest Park Road, Atlanta, Georgia, for the development as a park in the City Council District 12, authorizing the mayor or his designee or the chief procurement officer or their designee on behalf of the city to execute all documents necessary to acquire the property, authorizing acquisition, due diligence, closing costs, signage, demolition, site stabilization, and other site development costs to be paid from the Park Impact Fee South account in the amount not to exceed $122,000.00, as indicated in the account listed below, amending the 2023 General Government Capital Outlay Fund budgets in the Department of Parks and Recreation and Finance, Parks South Service District by transferring to and from various accounts, waiving Section 2-1541D of the Procurement and Real Estate Code of the City Code of Ordinances, Article 10, and for other purposes. There's an amendment that was emailed to you during the meeting. It just corrects account strings.
I'll move to amend. Second by Westmoreland. Please open the vote.
The vote is open. And the vote is closed.
The motion to amend is adopted. 6 yeas, 0 nays. Deputy Commissioner Boss.
Thank you, Chairman Dozier and members of council. I think that was a very complete caption that covers what we're trying to do here, but I would like to say that this is an important property for the Department of Parks and Recreation. We've worked hard to acquire this property. We've worked closely with the Conservation Fund. It is the first park in District 12 that is south of 285, and that is an important milestone for the department and the city in that we try to acquire property that not only increases the acreage that's available for parks and green space, but makes it closer for residents to get to parks. So we're very excited about this purchase and happy to answer any questions you might have. Thank you.
I actually do have a quick question, and I'm appreciative of the department for your help and feedback as we look for opportunities to expand park spaces in our communities. I appreciate Commissioner Cutler for being responsible about an opportunity that was presented by one of my constituents about possible opportunities for expansion or creation of new park space. Is there a specific protocol or specific set of steps that we as council members should follow as we look for opportunities like that? I appreciate Commissioner Cutler's responsiveness. I don't know if I should need to go to him every time I have an idea for more park space, or y'all are fine with that and it's not really disruptive of your work?
It is not a problem. We actually meet on a weekly basis to talk about this, and we'll take it by any means possible. Email, we do have a questionnaire that if you would like to forward to anyone, it pretty much details all the things we would ask, but we'll take email or any other form of getting that to our team to look at the property and trying to see if it's going to be a viable solution for park acreage.
All right, thank you. Any other questions or comments from colleagues? Seeing none, I'll go ahead and move as amended. Second by Winston. Please open the vote.
The vote is open.
All right, this is a favorable as amended, 6 yeas, 0 nays. Next item. Actually, I believe that's our last one for this section. I think next is resolutions. All right, please move forward. I think we're on number 29.
Item number 29 is 22R4246, a resolution by Councilmember Mary Norwood requesting the mayor or his designee, including the commissioner of the Department of City Planning, notify council members of demolition applications in their districts and for other purposes.
Alex, I believe there was a request to hold for this particular item, so I'll go ahead and motion to hold. Second by Westmoreland. Please open the vote.
The vote is open. And the vote is closed.
All right, the motion to hold is favorable, 6 yeas, 0 nays. Next item.
Item number 30 is 22R4247, a resolution by Councilmember Mary Norwood requesting that paving and resurfacing be included as eligible project types in impact fee expenditures and for other purposes.
This one was also asked to be held. I'll move to hold. Second by Westmoreland. Please open the vote.
The vote is open.
All right, the motion to hold is favorable, 6 yeas, 0 nays. Next item.
Item number 31 is 22R4264, A resolution by Councilmember Jason Winston authorizing the mayor or his designee to execute an incumbent worker training agreement with McCart LLC on behalf of the Atlanta Department of Workforce Development, DBA Workforce Atlanta, for a term of 1 year commencing on September 1st, 2022 and ending on August 31st, 2023, in a total amount not to exceed $112,500.00, which amount shall not exceed $7,000.00 per trainee for the purposes of providing training to incumbent employees. All contracted work will be charged to and paid from the fund department organization and account numbers listed herein and for other purposes.
Thank you, Mr. King. Good to see you again.
This is my last one, I promise. So MyCard is another employer partner, and this is an incumbent worker training program, so that means we actually help offset some of the cost of training existing employees. This is a pharmaceutical plant over off of Chattahoochee, and the reason that we would actually pay to help train some of their employees is it makes them eligible for increased wages, and it makes them eligible for promotion, in addition to providing them marketable credentials and certifications that should that plant change or move, they would be more marketable overall. While the maximum that we can provide per trainee is $7,000, this actual total project is between 50 and 75 individuals that will be upskilled. So the average cost per training should be between $1,500 and $2,000.
Thank you. Councilmember Winston, would you like to?
Yes, like to. Motion to approve?
I'll second. Please open the vote.
Vote is open. And the vote is closed.
All right, the motion is favorable, 6 yeas, 0 nays. Next item.
Item number 32, 22R4331, a resolution by Community Development Human Services Committee authorizing the mayor or his designee on behalf of the City of Atlanta to accept a donation from Savannah College of Art and Design to the Department of Parks and Recreation of improvements valued at approximately $115,450.00, which will include refurbishing backboards, repainting courts and court lines, and other repairs and amenities at Adair Park 1, located at 742 Catherine Street Southwest, Atlanta, Georgia 30310, Howell Park, located at 983 Ralph David Abernathy Boulevard Southwest, Atlanta, Georgia 30310, and Mosley Park, located at 1565 Martin Luther King Jr. Drive Southwest, Atlanta, Georgia 30314, and for other purposes.
Deputy Commissioner Ross.
Another complete caption. Just wanted to acknowledge Savannah College of Art and Design has worked with us before, most recently at Arthur Langford Park. This has been a very successful program. We've had a number of courts throughout the city with many different project proponents. This particular one has been reviewed both by Park Design as well as the Office of Cultural Affairs, and we recommend passage of this resolution.
I did have one quick question. What is there any sort of community engagement tied to this, especially since it looks to be an artistic installment in a public park? I imagine communities might be interested to know what's coming their way.
Some have had, excellent question. Some have had more than others. The one at Adair 1 has had a lot of public engagement. That used to be a court, then it stopped being a court, and now is actually being replaced with a basketball court again. So some more than others, but yes, to some extent they all have.
And what's the timeline that we're looking at?
The one at Adair 1 is already underway, and so we wanted to make sure we got the legislation in place before completion, but they'll be done before the fall.
If we have community members who would be interested to see what the designs are going to look like, I'll just use a follow-up email. I do one of these parks in the district that would love to see what we're looking at.
Yep, if anyone still would like to see them, no problem.
Perfect. I'll move approval.
Great.
Second by Bakhtiari, please open the vote.
The vote is open. The vote is closed.
Motion is favorable, 6 yeas, 0 nays. All right, next item.
Item number 33 is 22R4332, a resolution by Community Development Human Services Committee authorizing the mayor or his designee, including the chief procurement officer of the Department of Procurement, to execute an additional memorandum of agreement between the Department of City Planning on behalf of the City of Atlanta and Historic Atlanta, Inc., and authorizing the mayor or his designee, including the chief procurement officer of the Department of Procurement, to establish all required grant-related procurement documents, including but not limited to creating the appropriate purchase order between the Department of City Planning on behalf of the City of Atlanta and Historic Atlanta, Inc. to create an LGBTQ plus historic context statement for the City of Atlanta and for other purposes.
Thank you. We have with us Doug Young, who is the Director of City Design. I'm going to get the full title. If you could state your name.
Certainly, Councilmember Dozier. Doug Young, I'm the Interim Director of the Office of Design in the Department of City Planning.
Thank you. If you could tell us a little bit about this legislation.
Certainly. It's a great project that we've undertaken in the Department of City Planning in partnership with Historic Atlanta, Inc., was a local nonprofit historic preservation organization to document the LGBTQ history in the City of Atlanta. Folks might recall that last year we came to this body to have a resolution to authorize applying for the grant. We have done that. We've also been working on the grant itself for some time now, but upon further review, we learned that our resolution needed to be amended with a companion resolution to allow us to set up the proper financial instruments to convey money from ourselves to Historic Atlanta. Ultimately, the money is coming from the state of Georgia through the Historic Preservation Fund, Department of Community Affairs. So this will work with our current resolution and our current financial apparatus to get that money flowing to Historic Atlanta, which is actually undertaking the bulk of the work, and they are in fact providing all the local matching funds.
Questions or comments from colleagues? Councilmember Bakhtiari.
Motion to approve.
Second. Second by Westmoreland. Please open the vote.
The vote is open. The vote is closed.
Motion is favorable, 6 yeas, 0 nays. Thank you so much.
We appreciate your support. Thank you.
Absolutely. I believe that is our last ordinance. I think we were on to dual referred items. Item number 34.
Right, number 34 is 22-0-1711, an ordinance by Councilmember Antonio Lewis to amend the City of Atlanta Code of Ordinances to Part 3, Land Development Code, Appendix E, Atlanta Housing Code of 1987, Article 5, Judicial in Rem, Section 56H, Lien Waiver and Release, to ensure that the circumstances which would permit the constitutional waiver and release of such liens are properly reflected therein, and for other purposes. This item was approved 7-0 in Public Safety Legal Administration.
I believe that there was an ask to move this without a recommendation, but we do have Josh Humphreys here with the Office of Housing and Community Development. If you could just speak to this, just to give us a little bit more of a warm fuzzy about what this is before we make a motion.
Sure. Hi, everyone. Josh Humphreys, Office of Housing and Community Development. So we're working with Councilmember Lewis and the Law Department on a minor change to the paper. We want to make sure that it doesn't take away current powers to work with landlords to rehab properties, ensure we have high-quality housing standards in the city as part of the city's housing code. And so working through that, and we'll have a final version ready for Monday's council meeting.
Thank you. Any questions or comments from colleagues? Seeing none, I'll go ahead and move to approve without recommendation. I'm sorry, to move without, it's a day, to go ahead and push forward without a recommendation. Second by Winston.
Vote is open. And the vote is closed.
All right, this is favorable without recommendation, 6 yeas, 0 nays. Next item. I believe we have a couple items to come off of held.
Correct. Item number 40 is 22R3252. It's a resolution by Councilmember Byron D. Amos recognizing the Rodney Cook Senior Park Advisory Council and commending them for their work they have done to engage the community and develop and implement policies and procedures that will ensure the Rodney Cook Senior Park will continue to be an inviting and vibrant destination in the Vine City and English Avenue community for many generations to come and for other purposes.
Councilor Amos.
Motion to file.
Second by Bakhtiari. Please open the vote.
The vote is open. And the vote is closed.
Motion to file is favorable, 6 yeas, 0 nays. And then we have one more item, I believe is Councilmember Boone's legislation. I forgot what item number that is. Thank you.
Item number 50 is 22R4185, a resolution by Councilmember Andrea L. Boone urging the United States Congress to adopt the Medicare for All Act of 2021 and for other purposes.
Thank you. Colleagues, we held this last week last committee meeting because we had some questions with regards to the resolution clauses. I spoke with Councilmember Boone's staff, and they are in support of making an amendment to address a couple of the resolution clauses. I will go ahead and read those, or I'll read those. I'll describe those. Essentially, the ask was to distribute a copy of the resolution to the governor, lieutenant governor, all the members of the Georgia General Assembly, to President Biden, and to every member of the United States Congress. And so just recognizing there's a pretty Herculean ask of our clerk's office, we wanted to make an amendment to remove those two particular resolution clauses. And so I'll move to amend so that we strike those clauses. Councilmember Bond.
Well, I guess my question is that it's not without precedent that we've done this in the past, that we've forwarded the legislation to those different bodies. So how will they know what we have done if we don't forward the legislation to them?
That is a fair question. I will say that Councilmember Boone's office was in support of this amendment, and so I would defer to them in terms of in their work with the clerk's office to describe what that would look like, but duly noted to your point.
Well, I won't make a motion, but I'll make a suggestion that when this reaches the council that we work on an amendment. If you don't want to send it to each individual member of each body, they have, I guess, the equivalent of a clerk's office that we could forward it to ask them to then forward it on to the membership. But, just an idea, because if you're going to pass something and take a stand, if they don't get it, then, it loses its punch and its effect.
Understood. I'll continue with my amendment just based on the conversation I had with Councilmember Boone's staff, and I'm looking for a second.
Second. I'll second it.
Second by Bond. Please open the vote.
The vote is open. The vote is closed.
Motion amendment is adopted. 5 yeas, 0 nays.
I'd like to make I'd like to add my name to it.
The motion to amend by Bond to add his name. I will actually ask that I also add my name.
I'll take that as a friendly amendment.
A friendly amendment. And anybody else? All right, there's a motion to amend by Bond to add Bond, Bakhtiari, Dozier, Winston, and Amos as co-sponsors to this legislation.
Got it.
I don't know if I seconded it, but yep, I did.
The vote is open. And the vote is closed.
And the motion to amend is approved. 5 yeas, 0 nays. I will go ahead and move as amended. Second by Bakhtiari.
The vote is open. The vote is closed.
Motion is favorable as amended. 5 yeas, 0 nays. I believe this is our final legislative item for today. All right. Any general remarks? Councilman Bond.
Thank you, Mr. Chair. Our weekly HelloFresh distribution will be held tomorrow at 3 p.m. at the HelloFresh warehouse at 970 Jefferson Street, right off of Joseph Lowry. we have reached the 500,000 meals served mark in our partnership with Pratt Industries, Second Helpings Atlanta, and HelloFresh. And of course, we'll be honoring them Monday at the council meeting. So we're all asked that you all come to the reception early, and of course, we'll all be there for the proclamation. But of course, if there's no prerequisite to receive this help, if you need it, please come. We'll be there until the supplies run out. And if you don't need it, chances are you know somebody who might. Please pass the word along. Again, we'll be at 970 Jefferson Street at the Second Helpings Atlanta warehouse. That's 30318 at 3 p.m.
Thank you. Any other general remarks?
Just one reminder for those tonight that are interested in the Streetcar East extension from MARTA. We'll be having a virtual public meeting tonight at 6 p.m. You can go on MARTA's website to get information on the Zoom. I know that Councilmember Dozier and Juan and I had a great conversation with MARTA yesterday about this project, and hope the public will get engaged and involved. Thank you.
Councilmember Bakhtiari.
And just piggybacking on Councilmember Winston's remarks, there was a meeting last night as well, and if it came to our attention that not a lot of people were able to comment, Streetcar East has its own website where you can still go and enter your comments if you have any concerns, questions, etc. So please go and do that, and I hope that if you were not able to make it last night, you were able to sign on tonight. Thank you.
Thank you. Anyone else? I'll just close to just announce that District 4 will be hosting our next District 4 Town Hall, October 6th. It's a Thursday night. Will be actually held at the Wren's Nest, and because it'll be held at Wren's Nest, we have a different focus area at every town hall, and this one will be on historic preservation. So I hope you will join us, and as always with our town hall events, we will bring food. So come hungry, and come to learn, and come to ask questions. But that will be at 6 o'clock p.m. At the Wren's Nest on October the 6th. All right, with that, I'll go ahead and move to adjourn. Thank you all.